Hi, this is Dr. David Tenner. We're here at the Goldberg Tenner Clinic, where we specialize in the reversal of chronic disease. And today I'm delighted to be joined by Jeffrey Russell, who came to see us from Ohio earlier this year, and he's done beautifully under our care. So Jeff, tell our audience here what brought you in, what kind of health problem you had.
So I had ulcerative colitis. I had bloody bowel movements, diarrhea, like 7 times a day, and that was the symptoms, basically.
And so it's my understanding, and speaking with you when you first came in and getting good history, that you had had good health most of your life. Actually good health up until January, as I recall.
Yes.
Yeah, and what happened in January? What set all this off?
Yeah, I had a cyst that was removed, and then they gave me a preventative antibiotic, and right after that was when I started having the diarrhea and bloody bowel movements and all of that.
Not the first time we've heard that story. Antibiotics disturb the functional balance of the GI tract, particularly the microbes that grow down there. We've seen a number of patients with ulcerative colitis, Crohn's disease, collectively referred to as inflammatory bowel disease, who have developed problems as a result of antibiotic use. Sometimes just one course can do it. In many cases, there's repeat courses of antibiotics that have occurred prior to their diagnosis. And so Jeff is just another example of that. Okay, so Jeff, after you were diagnosed by your gastroenterologist, what was the plan for you medically? What did they recommend?
First they gave me a prescription for prednisone, and then mesalamine, I believe. And then after that, I didn't take either of those, but they wanted me to come back in for, I think, some biologics like Remicade was one of them, I think.
And this is a very common scenario medically. Patient goes in, has symptoms of ulcerative colitis, gets diagnosed by colonoscopy, and then out come immunosuppressant drugs. And there's a handful of them. Prednisone is very common, mesalamine is another one, and then they go on to biologics. All these drugs have the potential for very serious side effects. The biologics can contribute to allergic reactions. They can contribute to lymphoma, tuberculosis. We've seen these things happen with people who have been on them. Prednisone can contribute to diabetes, cataracts, thinning of the skin, osteoporosis, mental and mood disorders. There's a long list of side effects that come with these drugs. So we worked with Jeff and did a thorough workup on him to try to reverse this. And it's now been a few months, and Jeff is doing well. I'm going to let him describe the improvements he's had. But when he first came in, his C-reactive protein, which is a marker of inflammation, was very high. It was at 30. The normal range on that report that you brought to us was 0 to 5. So Jeff was definitely inflamed. He was definitely having symptoms, chronic diarrhea, bloody stool, all the symptoms that go along with ulcerative colitis. Were you diagnosed following colonoscopy by a gastroenterologist?
Yes.
You were, okay. And now it's been a few months, and Jeff has followed the specific biohygienic recreation program that we've developed for him. And Jeff, tell us what changes have taken place.
Well, my energy's a lot higher. I feel more relaxed and more able to focus throughout the day. I don't have any more bloody stools. My stools are completely normal. And yeah, basically I'm able to eat better. I'm able to, everything is 10 times or 100 times. It's just like living normally again, basically.
So gone from having about 7 liquid stools a day with blood in them to how often your bowel's moving now?
Usually once a day.
Once a day with no blood and no diarrhea, form stool.
Yep.
So that's something to celebrate, particularly for someone with ulcerative colitis. So Jeff's done really well. One of the major factors in his improvement is the fact that he worked hard. We gave him the steps to follow, but we can only advise him. He has to go home and kind of take the bull by the horns and follow through and implement those steps, and he did a very good job doing that. So he certainly earned the good results he's had. We're doing a re-exam today. His physical exam's normal, as you can see. He's a strong, healthy guy. Looks good, looks healthy and vibrant. We're also going to do some follow-up lab work now, including to send him over to LabCorp to get another C-reactive protein and a sedimentation rate down to make sure those inflammatory markers are now low. We expect that they will be based on the improvements. So we look forward to getting him reassessed and continuing this process. So Jeff, thank you for sharing your story. It's been a pleasure to work with you, and we look forward to continuing to build on the good progress you've made.
Thank you. Yeah.